Welcome to America's Heroes Group.
And with that, welcome to America's Heroes Group, our roundtable with our partner, Jesse Brown VA Works. January is Cervical Cancer Awareness and National Blood Donor Month. And don't forget, January 15th is Dr. Martin Luther King Day. But today is Saturday, January 14th, 2023. Our host is Kelley. I'm Sean Claiborne, the co-host, Army National Guard veteran. Our executive producer is Glenda Smith, and our digital media producer is Ivan Ortega of Scouts Honor Productions. And we have a panelist on the line today. That's Jeremy DeLizio. He's a licensed clinical social worker, community engagement, and partnership coordinator at the Jesse Brown VA, serving the Northwest Indiana area. And to give us some background about Jeremy has been with the VA since 2017, working with homeless veterans until 2020. First with the VA's HUD-VASH program in California, where he housed and then case managed chronically homeless veterans to maintain permanent housing. Jeremy then transferred to Jesse Brown VA's Community Resource and Referral Center, where he worked as an intake and outreach social worker, serving homeless and at-risk homeless veterans. He's a son of a career Navy veteran and is passionate about joining the community to work towards ending veteran suicide. Jeremy is also a proprietor of the Veterans Counseling, a part-time private practice. How you doing, Jeremy?
Doing great. Thank you so much for having me.
That's great to have you. Got a little echo there, but so how are you doing today? So things are going pretty well with what you're working on. You're doing some great things in the community. We want to talk about the Jesse Brown VA, your community engagement, your partnership program, and then also what are some of the things that are important to you that you want veterans to know, and particularly when it pertains to your work. To get us started, what is the importance of your role at the VA?
Yeah, so I really think I have one of the coolest jobs at the VA. It's pretty new. I've been in this position for about 2 years. First, I'm going to give you the high level and then move to the local level, which is where my position is at. So first and foremost, suicide remains VA's number one clinical priority. But I am a part of VA's new nationwide public health approach to suicide prevention. And on a national level, VA is disseminating and implementing the national plan for preventing veteran suicide, buying a lot of ad space, partnering with the National Shooting Sports Foundation, and funding my position nationwide as well. At the state level, VA is partnering with SAMHSA to implement the Governor's Challenge, where the VA and SAMHSA are going to each state and inviting governors to basically take my priorities and implement them at the state level for policy. And I'll get into what my priorities are in a few seconds. Then you have my role as a community engagement and partnership coordinator. As I mentioned, they're they're filling my position nationwide. And it is my role to go into the community and join existing suicide prevention coalitions and create new veteran-focused suicide prevention coalitions. And I have these 3 priority areas that I'll get into in a few seconds, but that's just the high level of what I do. Everything I do is community-led, so it's not the VA going into communities and saying, hey, we think you should do X, Y, Z. We want to partner with communities to really reach veterans where they live, work, and thrive. Because we realize, we can't prevent veteran suicide just inside our walls. So this is a really, when you think about this, I want you to think about as suicide prevention as a proactive upstream approach. So we want to reach people well before they reach crisis.
Mm. And how do you go in and actually help homeless veterans or help veterans in the community to get this care so that they don't get to that tipping point?
Right. So in my role, what I do is we survey the area. So I specifically cover Northwest Indiana. I reach out to a lot of different stakeholders inside the VA, outside the VA, and really understand, we do our best to really understand the community first, right, before we go into it. And then we reach out to the different stakeholders and let them know what our priority areas are. So I mentioned we have very specific priority areas that national VA distilled down from, I think it's 16 national priorities down to 3. For community-based public health. So first and foremost,
so go through those priorities and kind of give us an idea about when we think about priorities from a military background, we think about it from a perspective of a mission or of a task-oriented goals and things like that. But take us down this, what's the most important thing as far as your priorities and what you're working on?
Exactly. So that's exactly it. So these are kind of our, marching orders of what the, national VA thinks will help reduce suicide risk throughout the nation and our communities. So the first one is identifying service members, veterans, and their families, and risk ID. So what that means is we want to go out into the community and do everything we can to help community organizations culturally competently identify veterans. And what that means is, let's say you're a community mental health organization and you're typically screening for veterans just by asking, hey, have you ever served? Are you a veteran, right? Mm-hmm. Well, we really, the more culturally competent way to do this to kind of catch a wider net. So it's having people screen and ask, have you or a family member ever served in the armed forces? Because there's a lot of veterans who may not identify as a veteran or, are just used to saying no and moving forward, right? And this also captures those family members. So what we do is we have these coalitions that take on this priority area, and let's say we have a local mental health agency who's a part of that coalition. We then work with that local mental health agency to implement this screening question, but we also train them on military cultural competence, and then also what to do when someone says yes, right? And that's the complicated part. That's the hard part. Is how do you then connect them with services and the VA and and also the community. So that's the other really big part about my role is really just as equally connecting the VA services, connecting the community resources. The other half of that priority area is risk ID. So we want to get out into the community and train everyone we possibly can and suicide prevention trainings, and the VA's version is called VA Safe, and military cultural competence and all that. So we want people in the community to be able to identify folks who are at risk and so forth. The second priority area is connectedness and care transitions. So this is my really broad one. Connectedness, really has anything to do with reducing isolation, creating more connection to the community. It could be connected to resources and care, but it also could just be simple, community. A lot of folks who are at risk feel very isolated. So we want to do everything we can to really create a culture of community, in our communities, actually. And then the second part of that is care transition. So veterans and people in general are, pretty high risk when they're in transition. And what that means is, let's say you're inpatient somewhere, you're transitioning back to the community, or even, especially what brings home for a lot of veterans is, when I'm transitioning out, right? Transitioning out of the service, that's a very high risk time. So we want to make sure we build up resources in the community and at the VA that really try to, smooth that transition out a little bit, increase connection between providers, from the VA to the community to the VA, and community to community. And then the third priority is lethal means and safety planning. So lethal means is, what someone chooses. So lethal mean is what someone chooses to complete suicide, right? So it could be a firearm, could be a substance, could be hanging. And what this priority area is we want to train the community on how do we reduce access when someone's at risk. So we want to, if we've identified someone who's at risk, maybe we don't want to take away people's weapons, but we want to have those conversations around, hey, maybe we should lock it up. Maybe we should, give this to a friend while we're at risk, and then you can get your weapon back, when it's time, or train someone to identify, oh, looks like you're kind of stockpiling your medication. What's going on here? Things like that. And then we, through coalitions, what we'll do is we'll do like, medication disposal days, gun lockbox packing events. So there's a lot of things you can do with that, in the community.
Mm-hmm. So let me ask you
this. I think that basically covers it.
It's a lot of seconds there. So let me ask you this. What is, let me back up a little bit. So you basically work more with public policy. So you kind of see an aggregate of the numbers. You kind of look at it from a wider point of view. Have you seen in the numbers from a public policy perspective a connection between homelessness and suicide for veterans?
So I'm not a researcher, so I couldn't, say, yes, the research says this, the research says that. I would definitely say our homeless veterans are at, high risk. And, just coming from that, that's where I started in the VA. I would say, yes, absolutely. There's a connection. Is it more than, a veteran who might be struggling, who's housed? I think it just depends on what's going on with that veteran in that particular, because suicide is a very, unique situation for a person. And it's really hard to boil down and say, this is, homeless folks are, compared to other folks are way higher risk. I mean, yes, they are, but there's just a multitude of variables there, right? Mm-hmm. So I hate to, pigeonhole that. But, yes, and one thing I want to say, when it comes, the VA has made massive strides, especially here in Chicago. I was just speaking to one of our homeless social workers, and they with the biggest this last housing push we've had, they're through a lot of the through a lot of the homeless veterans. I'm lost on the word right now, but now they're really just dealing with a lot of the chronic cases that are really difficult. But through a little kind of lesser chronicity cases, a lot of those folks are now housed. So it's really good.
That's really good. So your father was a career Navy veteran or Navy service member. So so growing up, how did that shape your ideas about the military? And then also, how did that lead you? Did that lead you in any way, help you get to the VA?
Yeah, I think so. It's funny, because growing up, I didn't realize until I started working for the VA, and this was, so my dad retired when I was around 5th or 6th grade when we moved to Illinois. I thought everybody did 20 years in the or career. I'm like, what? Oh, people are much shorter? Oh, wow. So that was kind of shocking for me, but yeah, it's always kind of been a part of me, and I always thought I would either go in myself, or it was just kind of just always lingering in the back of my head, and then nothing really stuck out to me in school, and then I finally took a sociology class, and I was like, all right, I like this, and then I got my bachelor's in sociology, and then I graduated, and I was like, well, what can I do with this? Absolutely nothing. So someone came along and explained social work to me, and I was like, oh, this is sociology in practice, great. And I just kind of found my way to the VA because as a social worker, there's no better I think there's no better place to work than the VA anyways, but definitely as a social worker, it's fantastic because it's the level of support and you get from nationally.
So tell us about this hashtag reach out. Is that mission hashtag reach out or this hashtag reach out? What is that all about?
Okay, so mission reach out. So that the hashtag is there for SEO purposes, but yeah, hashtag reach out. So it's similar to the Ice Bucket Challenge, but for veteran suicide prevention. So that's what I want you to think about when you're kind of conjuring this image. So Mission Reach Out is a unique challenge that I created to prevent suicide through the power of meaningful conversation and basic human connection. So this challenge has a veteran tinge to it, but it's really meant for everyone because we all struggle. Mm-hmm. And veterans do not live in a vacuum. So if we want to prevent suicide, we as a community must kind of break down all those silos, engage with each other, and ask our friends, families, and strangers, how are you? No, really, which is actually the slogan of this campaign. It is designed to prompt people to have meaningful conversations. And like what I mean by a meaningful conversation is to learn something about another person, yourself, or the world. A meaningful conversation or connection can be a powerful tool for someone in crisis because people experience a crisis often and it cannot see a way out of their problems or immediate situation. So any connection can kind of be like a breath of fresh air, Mm-hmm. So these conversations actually do not have to be about mental health or suicide. It's just about connecting beyond that surface level. So the challenge is to have 7 meaningful conversations over 14 days. And then like after that, we ask that, post on social media or about what is meaningful to you and nominate someone else to take the challenge. or do this in person and just share the challenge with a friend. Because if you think about the numbers here, right? So if we have, if someone has 7 meaningful conversations over 14 days, that's, and 100 people do this, that's 700 meaningful conversations. That's 700 opportunities to reach somebody. So we actually implemented this at the Jesse Brown Hospital and all of our outpatients clinics, and there's a physical version of this. So I got these white envelopes, and they're stamped classified with a mission brief that kind of explains the challenge just the same way I did. And then there's also a QR code that leads to a link with a whole bunch of resources for veterans, for the general population on how to have meaningful conversations and mental health links and things like that. And we've actually built out this entire web-based platform for this. We even made a commercial.
Wow.
So I would love to plug that link whenever that time is appropriate. But that's the challenge.
Go ahead.
Okay, so the link is linktr.ee/mission reach out. MISSIONREACHOUT.
One more time, repeat that link. We'll probably post it on our website too as well. So if you're listening, go to americashg.org and you can see everything we're talking about. And also, of course, go back and replay this on YouTube, Facebook, and things like that. But I think it's really important that the thing that you're talking about is making sure you have meaningful conversations, because that is because it seems like when we read about suicide or talk about people that have done things, either damaged or hurt themselves or hurt other people, the thing that sticks out to me is isolation. And when you start having meaningful conversations with people, you start to get to know and understand where they're coming from. And I think that's one of the biggest barriers, particularly as a veteran, when you come back and you can't really connect with your community because they haven't really experienced the things you've experienced. So it's hard to have that connection. But how do you get a veteran to open up, particularly if they feel like you don't know where they're coming from?
And that's a difficult question because every person's different, but I really see it as just being open and honest with them. Because I don't think veterans expect you to, hey, I had those same exact experiences as you. So I think a veteran cringes, when they say, hey, I know how you feel, because, no, you don't know how I feel because, and actually I was at a suicide veteran talk recently, and they actually talk about this subject. And a lot of veterans feel that way about even other veterans, right? Like, oh, I was over here in this war or in this area of Iraq. You don't know what I went through. So I think everybody feels that way. So it's not about saying, hey, I know how you feel, but it's saying, hey, I'm here to listen. And just being that, sounding board for somebody it means so much, because so many people just want to, they want to relate to you so bad, and it's just, all right, let's just listen and hear you and let you get it off your chest. And then I think that kind of opens up those blinders, because I think when someone's, really high risk, they can't see 5 feet in front of them. So I think anything we can do to just kind of get them through that fog is really important.
Well, I think that's really important, because basically what you're doing is you're making a friend, or either that or strengthening a friendship that you might already have with someone when you start to really just be an ear, as opposed to just always, wanting just to tell a person or try to, give cliches we've heard on the TV or radio about how to. I know, that's okay. Yeah, I understand. It's going to be all right. That kind of stuff what people don't want to hear.
Right.
So let's see. What's the one thing you want to make veterans know about? Or what do you see when you meet them? What do you want them to know? What's the first thing you want them to know, or the most important thing you want them to know?
Yeah. So I want all veterans and their family members to know about our national hotlines. I think it's, one of the most important things for people to know about. Starting with our crisis line, which is now 988. So this transitioned over the summer. The national suicide hotline is 988. And then for veterans, they just have to press 1 to reach the VA crisis lines. So this is the same number as a national suicide crisis line. And I saw some interesting data on this, and you'd be surprised on how many people really don't know to press 1 and how many veterans don't know to press 1. So I really want them to know that. And I also want them to know that this is a crisis line, meaning you don't need to be in suicidal crisis to contact it. If you're a veteran or someone who is concerned about a veteran who is struggling for any reason, you can call this number for support.
Now,
And then, sorry, go ahead.
one more time, give us the link to the hashtag reach out so people can get that information as well, because you have a lot of good information on there. And also I think it goes back to that point of earlier about making sure that you can ask the right questions but listen to people and make that connection.
Right. So that is www.linktr.ee/MISSIONREACHOUT.
All right, I appreciate your time. We had a lot of good information, and also I want to have you back because I want to get into what you've done in your career. You've done a lot of cool stuff as far as helping people, particularly in very difficult, areas of homelessness and suicide. I mean, that's really, really tough. And to have someone that has the time and the attention and also the patience to go through that and spend the time that you spent over the last years dealing with that, I really got to commend you on that, especially when it comes to the veteran community.
Thank you so much. It was a pleasure to be here.
Jeremy DeLizio, licensed clinical social worker, community engagement, and partnerships coordinator at the Jesse Brown VA, serving the Northwest Indiana area. Thanks for your time.
Thank you.
This is America's Heroes Group. We'll be right back.